Welcome to the Pain Medicine Institute, where our dedication to leading-edge pain management technology and minimally invasive procedures is surpassed only by our dedication to the personal quality care patients deserve. We are part of a group of specially trained, caring professionals at the forefront of pain medicine, providing comprehensive treatment for the management of acute and chronic pain syndromes, taking pain management to the next level. With nearly 1/3 of the population struggling with chronic pain and many being inadequately treated, we are intimately aware of the devastating effect pain can have on people's daily lives.
When people are in pain, they just want to curl up in their bed and just disappear, and that's not what life is.
I quit everything I ever did when this started up. I was afraid to do anything. I was afraid to walk. I was afraid to exercise. I was just in fear of any kind of movement, for fear it would make it worse when you don't think it could possibly be any worse.
I would come home at night in tears. And I would lay on the floor with my feet on a chair, trying to get some kind of comfort.
I was in a position where I just couldn't do what I wanted to do anymore. And I was just going downhill.
If I had a scale of 1 to 10, I would say my pain level was 15. It was off the charts.
You'd have a pain just radiate all the way down out your toe from your lower back. And even if you try to suck it up, it alters your whole mood because you're just trying to hold it all in.
At the Pain Medicine Institute, we know the right treatment can dramatically improve a patient's quality of life. We also know that successful pain relief comes from a customized, individualized, multimodal approach. Our goal is to provide a full range of treatments and services for patients suffering from spine pain, neck pain, back pain, sciatic nerve pain, failed surgeries, and other painful conditions.
I set goals with my patients based on their own goals. So everyone is unique. Some patients' goals are simply to be able to walk to the mailbox and back. Some people want to be able to, play with their grandchildren. Some people want to go back to work. Some people have an acute disc herniation and want to be free of pain. And this is a new pain that's been ongoing for 6 weeks. And so some people we can cure. Some people can walk away and we can never see again. But some people have, had chronic pain for 20 years, and it's unrealistic for them to think that we're going to cure them. However, our goal is to help them reach their goal. So we'll do everything in our power and within our knowledge base and within our resources to help each patient individualized reach their goals.
I always tell patients at the Pain Medicine Institute that most of their conditions did not originate overnight. And I think setting proper expectations is very important in preventing patient frustration and most rapidly achieving our patients' goals. When we see our patients, we aim to lay hands on the patient, physical diagnosis, look at the history, try to come up with an accurate diagnosis and plan, and most patients can achieve a pretty significant improvement in their condition within 2 weeks. I do tell them, you did not get this way overnight. Expectations that in one visit I can solve all of your problems is unrealistic and frequently would lead to frustration. It's a path. A true chronic pain situation requires a long-term and a short-term plan.
Along with our residing physicians, our patients benefit from our clinic's nationwide network of multidisciplined pain management physicians, each with a unique set of strengths and skills, and available for collaboration anytime they're needed.
There is occasionally a patient that I don't have all the answers for, and I want to go out of my way to make sure that that patient gets the best treatment possible. So in that circumstance, the beauty of the Pain Medicine Institute is I can either call one of my colleagues or I can refer this patient to one of my colleagues who can perform an evaluation and treat the patient based on their background and their training, which might be slightly different from mine, or they might have a different specialty altogether, as if, I were to send a patient to a surgeon or a psychiatrist. So we have a team-based approach, and we all have open communication amongst each other as well.
Pain is not a situation or a condition that usually is met with a single answer. And so what we find is multimodal approaches are the most effective. And these can encompass anything from care from psychiatry, surgical specialties, interventional pain medicine, which is what we can provide, and sometimes medications. Physical therapy is also key. When you combine all of the modalities, your outcomes are clearly better.
What sets our physicians apart from other clinicians is that they have received extensive postgraduate medical training in anesthesia, physical medicine and rehabilitation, neurology and psychiatry. Our doctors are fellowship trained with board certification in pain management. We are proud to have helped set the standard in pain management with interventions like fluoroscopic guided procedures, ultrasound guided injections, and kyphoplasty. We are using neuromodulation techniques like programmable intrathecal infusion pumps, spinal cord stimulation and peripheral nerve stimulation to treat chronic spine and extremity pain, intractable headaches, and other painful conditions. We are also now able to perform procedures that in the past required open surgery, using a minimally invasive approach with new technologies such as percutaneous disc decompression and minimally invasive lumbar decompression, also known as the MILD procedure. And our results speak for themselves.
My life, it's changed due to the fact that my mind is more clear. With pain, you can't think. And I can do dishes, I can cook our meals. I do things around the house that I couldn't do before. I take care of them, my dogs. I can't walk them, but I brush them, I feed them, I love them, I play with them. I take them for walks on the golf cart. I've trained them to walk alongside the golf cart. The good thing about the doctors there is that they don't stop until they get you some kind of relief. He was going to do anything that he could possibly do to get me my relief that I needed. And anybody with chronic pain and that lives with it every day, I would recommend them calling them because they are fantastic.
I trust that man with my life. I mean, without him, I wouldn't have a life. It's just that simple. I had to give up bike riding. I had to give up doing things with my family because you're not functioning. The only thing you think about 24/7 is pain and how much it hurts. By taking the medicine and doing what the specialist says, I'm able to function. I'm able to work 40 hours a week, which is what I do. If you were at my job, you wouldn't know I was seeing a pain specialist because I'm normal as I can be.
It was obvious after the first month or two of being there that his game plan was the same as mine, and that is to not just take a pill every day, but to find the solution and get you off of the medication and back to living again. My fear was going in and just being given pain medication and not actually looking for the source of the problem or what we could do, down the road. I think these pain management type places get a bad rep these days, and I wanted to be able to have a goal in sight when I sat down with that doctor. Okay, it wasn't going to just be to come on for the rest of my life, and take pain medicine.
The perception of pain medicine has been scarred recently, and unfortunately, it is due to the practice of pain medicine, in most cases by individuals who are not trained in pain medicine. If you look, the vast majority of individuals involved with pill mills were not fellowshipped and board certified pain management specialists. At the Pain Medicine Institute, we are. We are fellowship trained, we are board certified. Some of us have even functioned as university professors, teaching other individuals how to properly perform the procedures and techniques of pain management. It's very unfortunate that the public perception has taken that particular viewpoint of our field. And I tell people frequently that the individuals who did result in the damage to the name only stole the name. They did not actually perform pain medicine. And providing an opiate script and sending someone onto the street is not pain medicine.
Many of the medications we use today have been modified or improved to allow patients to take much smaller doses and still receive the pain relief they desire. This helps us maintain strict standards regarding patient medication management.
What's unique to this practice and to Pain Medicine Institute as a whole is that we have availability of performing a genetic test. For each patient, you get a profile back that shows you which category of drugs the patient is going to respond best to and how they're going to metabolize some of the drugs. So if they are going to metabolize a subset of the drugs too quickly, then the patient's never going to get any benefit from it. So the DNA testing allows us to see, how fast or slow they're going to metabolize certain drugs and certain drugs that are going to stay in their system longer and give them more relief.
Our commitment is to walk hand in hand with you and provide you with a customized and thorough treatment plan that will allow you to enjoy a higher quality of life with little or no pain and minimal side effects from medications.
I'm happy. I got my life back, I'm a lot more active, I'm able to do things, and with that, your personality goes back to normal because you're happy again, you're not in pain, and it doesn't make you, tired. When I came home, I had a whole new glow about me. The kids knew something was up because I've been through a lot of these surgeries, and I come home happy or looking forward with good expectations. My whole mood changed. I was just glowing. I knew everything was going to change because I felt the relief instantly, and I never felt that before.
I've got a change of life right now. I could do the things that I couldn't do in the past. Is a sure relief, and there's going to be some changes in how I approach life and the things that I want to do.
They were so caring to me. I passed the physician's assistant in the hallway, and she would hug me, and she would say, "It's going to be okay." And from that moment on, I knew that I was with a staff, and that works together, that cared, that listened. From the very first day I walked into that door, I knew that the people in that place cared about me. When I was crying, it was like, it's gonna be okay. When I, got so upset because I've just been married for 2 months, well, it's all right. We're gonna figure this out. We're gonna do something. My life has totally changed. It is the most amazing thing to go from bed at 3 o'clock in the afternoon or earlier to going and doing what I want to do as I want to do it. And I'm so excited for the life that I have now. And I'm quite sure that if I was still in Missouri, I'd still be in that wheelchair.
I enjoy coming to work every day at the Pain Medicine Institute because I feel we can really make a difference in an individual's quality of life. When I moved to Florida, I moved down in the midst of the pill mill chaos and had, for the first time, actually felt a bit of embarrassment when I would tell people what I did because the perception was so off. And I believe that it's institutions like the Pain Medicine Institute that can properly demonstrate what this field should be. And when executed with the type of individuals that we have here, we can change lives and really make a positive impact on the community and change the perception of what this field is.
I love pain management because I truly enjoy helping people. It's very rewarding for me, for someone to come into my clinic with 10 out of 10 pain and for me to come up with a comprehensive plan for them and for me to see them at their grocery store or 2 to 3 weeks later, 2 to 3 months later, out in the community or here in my office and to see them without their cane or without their walker and to see them enjoying activities of living and to see them happy. That brings incredible joy to me.
If you or your loved one is experiencing pain, we encourage you to take that first step towards a more pain-free lifestyle by calling to schedule a consultation. We are here for you and your family, and we won't be satisfied until our pain relief management experts get you the pain relief you deserve.